I'm not making a bed. That's a CNA's job. I went to nursing school to become a nurse, not to make beds. You'll hear that coming from nurses speaking down on CNAs, looking down on CNAs, and just flat out not respecting a CNA's position in their job title. When I was a CNA, I would be embarrassed to tell people that I was a CNA. I'm just a CNA. You're not just anything. You are a CNA. You went to school just like the nurse. Nurses who have been CNAs, LVNs, RNs, make the best nurses because you have been on that bedside. You've been on the other side of the coin. You know what it takes, what it entails to be a nursing assistant. That way you respect your CNAs. When I was a CNA working in the ER, one of the nurses asked me to get her a cup of water. And I was so excited to get her a cup of water. I was like, okay, finally, the nurse has asked me to do something for her. So I went and got a cup of water, put some ice, put a straw, and brought it to her. So excited. And she looked at me and she's like, I don't do straws. And I thought, rude, tacky, and just flat out unprofessional. And it's just unnecessary. Like, why do you have to go out your way to be nasty and mean girls to the CNA? When the physical therapist has a care plan meeting, the physical therapist will walk past the nurse to get to the CNA and ask the CNA, how does bed B get out of bed? How do they transfer? How do they do with taking showers? Is their activity? They're not asking the nurse, they're asking the CNA. And even inviting the CNA into the room with the care team to discuss how the patient is doing. Right? So that's how important the role as a CNA is. Now, don't get me wrong. There are lazy CNAs. Yes, lazy CNAs. I said that will go out of their way to ditch and dodge a call light, to be at their post, to be unfound, a whole lot of hiding. And if you just spend more of your day of actually doing your job and less hiding, you'll get more done, right? Now, on the other side, there are lazy nurses. Lazy nurses that will sit in the chair and scoot around the nurse's station. Ignore the call light and wait on the CNA to get the call light. Or at the bedside with patient B, and the patient's asking for a bedpan, and will excuse themselves out of the room to go get the CNA to bring the bedpan. Now, in between this time, patient has fell out of the bed. Now you have to send the patient out for a possible broken hip injury and contact the family and let the family know patient fell out the bed, when you could have easily just assisted the patient. The point of this video is, in healthcare, we all play an important role. It is important to understand and to know what the scope of practice of all roles entail. The CNA, Certified Nursing Assistant, is at the bedside doing the essential basic care for the patients. You have essential basic care, their ADLs, assisting with their everyday needs. The nurse, the LVN, is working under the registered nurse. So the LVN or LPN, depending on your state, is delegating tasks to the CNA that yes, they can do because it's in the scope of their practice as well. Essential basic needs is not in the scope of the LVN. The LVN can do that. Also, the LVN has extra additional duties of passing medication, doing admissions, discharges, communicating with the registered nurse, communicating with the doctor, communicating with the family, and also doing wound care and treatments as well. So they're a little bit more tied up. The registered nurse is doing all of those different things and also taking orders from the doctor, as well as supervising the unit, supervising the LVN, supervising the CNA, and ensuring that the entire care team is doing exactly what they need. So there is a chain of command. There are levels of respect. There are different positions and titles, and everyone needs to respect one another. I've had nurses come to work, look on the roster and see that there is no CNA that's today. And now like, oh, though there's no CNA today? Now the day is going to be a nightmare. Right. So you do need the CNA. After all, you think? That means we all need each other. CNAs, I want you guys to lift your head up high and own the title CNA. Value yourself. A lot of times people will treat you how you treat yourself. If you walk around the room and say, well, I don't know, then people are going to treat you like, well, I don't know. If you hold your head high and say, I'm a CNA, my name is Candy, how can I help you? I'm here to serve you today. People are going to treat you with respect and dignity. You are a trustworthy healthcare professional. You have integrity, you have value, and you have purpose. The facility will not run without a CNA, period. So know your title, know your scope of practice, know your value, and know your worth. Nurses, let's do better. It's one thing hearing from outside people about CNAs, what they do, what they don't do. Oh, they only change briefs all day. They only do this. Okay, the CNAs get enough of that from the outside people. But you're on the inside and you know good and well that if a patient needs to have patient care needs, it's not only going on the CNA. It's the nurse's responsibility too. It's a collaborative affair. We all play a part. It's not about me. It's not about you. It's about the patient in the bed. It's about someone's loved one, someone's mother, someone's father, someone's grandmother, someone's grandfather. It's not about me and it's not about you. So let's do better, work better together, and start standing as a united front as we all went under oath and said we would. Let's not throw one another on a bus to make ourselves start to feel better. It's this whole superior complex issue that goes on. I'm superior than you, so you're going to do what I tell you to do. Then it goes back to, you weren't a CNA, were you? You were not. So I recommend anyone who is looking into going to the nursing field, start at the level of a CNA. It's going to help you master your bedside manner, your bedside skill, get that confidence. And if you choose to move forward and go on with your healthcare, you'll know how to treat your CNAs. Let's do better. The purpose of this video was just solely to let you know as a CNA that you matter. You are heard, you are seen, you are valued, you are worthy, you are needed, and we need you. Okay? All right. Make sure you like, subscribe, and comment if this resonates with you. And if you like more videos like this, feel free to let me know. More in the pipeline is coming. Talk to you guys soon. Learning with Nurse Candy. Bye-bye.